Nesta próxima apresentação, a gente vai falar sobre o caminho para a transformação digital com o líder de engajamento de C-Suite na Philips, Mike Graves. Welcome, Mike. Seja muito bem-vindo. Seja bem-vindo.
Muito obrigado, bom dia e seja bem-vindo. This is all the Portuguese I know. Thank you. Good morning, welcome to day 2 of Connect Day. Yesterday was great. The presentations were great, the content was great, the conversation and the dialogue and the energy was great. And I'm excited to build on that momentum today. Yesterday, I particularly appreciated the panel discussion on digital transformation that Dr. Schwartz led with our 4 wonderful guests. And we heard from them some things that you and I experience every day. Digital transformation in healthcare is hard to do well. We know digital transformation in healthcare is about more than technology. Digital transformation is organizational transformation. Even though we know that it's organizational transformation, we struggle to find the path forward in many ways. So this morning, we want to build on that conversation and share with you some thoughts and some ideas that I hope you find very useful in your organizations to help navigate this path forward in the organizational transformation related to digital healthcare. My name is Mike Graves. I've spent 25 years working in health systems. I was a therapist for a while, and then I did EHR implementations, and then I did consumer digital type transformation. Just 2 years ago, I came to Philips for the purpose of helping Philips help its customers in this way. So, let's begin. Let's begin with some context. This is just stepping back a little bit and looking at digital trends by country. This is some research done by the Organization for Economic Cooperation and Development, or OCED. And this is just looking across 6 categories of digital readiness, looking at countries around the globe. I realize it's hard to see maybe the bottom of the screen, but you can see over here, this is Korea. Way over here, this is Sweden. There are a couple of Latin American countries here. Colombia is over here towards the leading edge. We have Chile here, kind of, towards the middle. And I looked at this and I thought, well, I wonder where Brazil lies, our host country, since we're here. So I did a little more research and I found it. So imagine where you think it might be. This is not healthcare. This is just, as a country, how prepared are we for digital things? Here's your answer to Brazil. Above average, on par with European countries like Italy, for example. So as a country, okay, we're ready. Also, as different countries across Latin America, we have different levels of readiness. The point is, we all are starting somewhere. Generally, we're leaning toward the digital world. Second, just opening context slide. Now we talk healthcare, not digital, just healthcare. If you take these countries and you look at the combination of how much do we spend per person on healthcare per year, and how long do people live on average in the country, you get this graph. And I don't know if it's the first thing you notice, but the first thing I notice is this very lonely dot over here by itself. My home country, the US, where we outspend every other country in the world by far on healthcare, and yet we're in maybe the 35th percentile for life expectancy. We have, in my country, an efficiency problem in healthcare. Well, where is Brazil on this? I'll show you. Over here. Notice, I have to walk a long ways because you in Brazil spend 1/7 of what we spend in the United States per person per year on healthcare. However, pretty close in life expectancy. And if you look around Brazil, you'll see a couple other Latin American countries, Mexico, Colombia, Costa Rica, Chile. Generally speaking, in Latin America, the amount of money we spend on healthcare is conservative. And so I put this to you to say we have an opportunity to build an efficient health system in Latin America. And digital transformation is one important tool to do that. Why is that true? Because this is the reality. Healthcare is already and is increasingly becoming distributed in its nature. No longer is it just the doctor in the hospital or the clinic, but it's meeting the doctor and the patient where they are with the data they need when they need it. Distributed, integrated, networked models of care. This ultimately is about the data, and it's about finding ways to tame that data. So I did one more piece of opening research, and I looked at digital healthcare. I put the two together and looked at digital healthcare in Brazil, since it's our host country. But I would say that the trends we see here are pretty much universal. The data happens to come from Brazil. And what the same research from 2021, by the way, tells us is that despite being relatively progressive as a country digitally, in healthcare, the benefits are slow to materialize. We see unequal distribution of healthcare access and digitalization. We see that among both the workforce and the patients. And in this article that was talking about digital transformation in healthcare in Brazil, they said there were 3 things we need to do. Number 1, we need to close the gap in access. You know, in Brazil in particular, there's a big gap in rural and urban. I know in Brazil and other countries, there's a gap in rich and poor with access to the tools that we need. So number 1, we need to bridge the digital divide. Number 2, we need to create the forces in the economy to drive this forward. We need to have the funding and governance that drives this path forward. And number 3, we need to get about the business of transforming our healthcare organizations, providers, practices. And this is where we're going to focus today. Today we're going to focus on how we can do this together. Because we believe, and I think you believe, that digital technology can meaningfully transform healthcare in many ways. Reduce cost, improve outcome, improve experience, make it more sustainable, close that equity gap. It can work. Most executives think so too. We're innovating with urgency. You all are innovating with urgency. However, pulling some data again from the inefficient United States, it's not working. And I don't think this is just in the United States. I think we are all struggling with getting the most value out of our digital investments. In the US, this particular data source told us only 1% of executives felt like the money they spent on digital technology gave them what they thought they would get. 1%. Moreover, employees are saying, not only is it not better, in some cases, you're making it harder on me with the digital technology. And by the way, in this particular study, our patients care. In this particular study, we found that 95% of patients in the age of, 18 to 34, they would switch providers for a better experience, better access, better digital experience. So this is all to say we have a great opportunity. We know what matters. We're trying hard and it's not working. So let's jump into this question. Why isn't it working? And what can we do about it? So here's why I think it's not working. It's because we have, in a simple phrase, found ourselves in this corner of this graph. We are digitally disorganized in healthcare. We've spent a lot of money. We've digitized a lot of things. We've put in a lot of effort, but we haven't seen the benefit that we expect. And because we are not quitters in healthcare and we're very smart, capable people, we say, well, that's not good enough. We're gonna fix it. And one way we try to fix it is we try to get more efficiency out of the process, and we engineer value in selective areas. And when we do that, we get more value, but only out of the things that we touch. We only fix the things that we touch. And then we think, well, okay, that's not enough either. Let's be innovative, and we try to innovate things, and we do. We pick selective things, and we make them happen. EMR, online scheduling, pick a few different things. We'll do them. And we have some success. However, We only fix the things we touch. And we create a fragmented experience for our doctors, for our patients. That is not ideal. And the reality is, we have spent decades, we collectively in digital healthcare, many years and many dollars, a lot of money, bouncing around these three quadrants. And what I want to suggest to you today is that there is a way to break free of that wilderness and find ourselves up here in a truly transformed digital world in healthcare. But how do we do it? And the answer comes back to what we heard yesterday from the illustrious panel. Digital transformation really is organizational transformation. The challenge that we face collectively is to find a way to create the organizational conditions to get the most value out of our investments. If we want to achieve the things in the middle, how do we create the context for it to happen? Let me try an analogy. Think about gardening. If your plants are wilting, you can't just focus on the plants. You have to focus on the earth and the soil and the tending to that earth and that soil. And so this is what we want to talk about today. And we kind of know this intuitively, right? So far you're like, yeah. But why do we have a hard time doing it? Well, let me take one slide to explain a view on that. One of the reasons why I think this is so difficult in healthcare is because we are such capable, intelligent leaders who are not quitters and will solve any problem, and we run areas like operations and clinical practice and innovation, et cetera. And when we struggle with operational efficiency in our health system, well, what do? We launch operational initiatives to fix it. And when we need something clinical to improve, we launch clinical initiatives. And then we get innovation moving, and we say, well, this experience isn't good enough, so let's pick an experience and let's fix it. And these are all highly competent teams of people solving important problems. But the sum total of it all is this digital disorganization for the patient and the provider and the employee. So I want to suggest to you this morning that there is another way. And it's instead of outside in, let's begin inside out. Let's start at the middle with the customer. The customer being, yes, the patient, but also the provider, the employee, everyone using this digital ecosystem that we care so much about. And then let's figure out a way to build the organizational conditions around them that will serve the purposes they need to achieve these things around the outer ring. Okay, how do you do that? Well, that's what this next slide is intended to be about. So, let's talk about what are the things that will help our organization create the conditions for getting value out of our digital investments. The first one, and I want to say you will have heard some of these yesterday because the panel is experiencing the same thing. The first one is a shared vision and a strategy. And be very careful here, because it doesn't only say a vision and a strategy. It says a shared vision and a strategy. What do we mean by this? Well, if we have clarity of purpose, but the CIO's clarity of purpose is different than the CMO's clarity of purpose, is different than the COO's clarity of purpose, and we're all launching our initiatives to solve it, we are just not working in the same direction. Perhaps one of the most important questions you could ask yourself to start about your organization is, to what extent do we have this in our organization? Do we have a shared vision and strategy, or do we not? And the difference is really in the collaboration across clinical, business, IT leadership. And if you don't have that, it's okay, but don't keep going. Stop and find it. Work together to establish a clear vision and strategy. And I'll point out, this is not a singular problem to solve. We can't solve for clinical experience or clinical quality at the expense of cost completely. And we can't solve for cost at the expense of clinical care completely. They overlap, and that's okay. The most important thing is to ask yourself, in your particular organization, what is our combination of priorities? Reduce cost, improve access, improve quality, improve experience. Whatever those things are, bring them together, but not in silos. Bring them together. So number one, start there. Number two, when we think about the platform architecture, the infrastructure that has gotten us to where we are in healthcare, it simply will not get us to where we need to go in healthcare. We need it. It is not money wasted. We spend a lot of money to digitize medical records or to our practice management systems and all of this, and it matters and we need it. However, it will not get us to where we need to go. So you want to ask yourself, is our digital platform, do we have a digital platform that will enable us to go into the digital future? What might that look like? Well, for example, in most environments that I've had the pleasure of being to, we have many underlying systems of record with a whole lot of data that may or may not, and usually is not, easy to access and understand. So part of a digital platform is making sense of all that data we spent so much time and money creating. So some sort of data layer, data lake, that harmonizes the underlying systems, because we certainly aren't going to go rip and replace all those things we spent the last 20 years putting in. So a data layer. On top of the data layer, do we have open access, API integration to that data? Do we have the components, the componentized architecture that allow us to be creative and think, if I put this together with this, I could create this solution that might solve this problem we agree we need to solve? If we don't have that, if we're sort of stuck in the traditional ways of delivering IT infrastructure and data architecture for healthcare, we are unable to join the party of digital transformation. So this is number two. Number three, those systems generate a lot of data, but that is meaningless unless we can do something with it. And we've talked a lot about this yesterday, and we'll talk more about it today. But thinking about your organization, to what extent do you have in place the capabilities that you need to manage the quality, access, and governance of the data that's being created by these systems that we have? And if we don't have that, solve for that problem. And that's just the beginning when it comes to data like quality, access, governance. Now we need to make sense of it. So to what extent does your organization have a capable analytics team that knows more than sort of demographic or descriptive analytics, but can do predictive and prescriptive analysis of that underlying data? And this is where, as we've heard over and over, generative AI can make a huge difference in making sense of that data. It's one of the questions of, a few years ago was, how are we going to solve the problem of all this disparate data? I think the answer is coming upon us with artificial intelligence. But if our healthcare organizations don't have the organizational capability to apply AI to the data, we will have a hard time making sense of all that we have. So that's number three, data and AI. Number four, funding and governance models. My observation has been that traditional ways of funding and governing technology investments and initiatives inside healthcare is oppositional to what we need in order to innovate in healthcare. What we find, at least predominantly from my US perspective, but I think it may be true here, you can tell me. We do things like annual capital planning or 5-year plans, where people put together their ideas for what they think we should do, and then they compete with other people about how important it is, and some people get money and some people don't, and if you get the money, then your job is to implement the thing that they gave you the money for by a certain period of time. And if you don't get the money, well, you come back next year with another idea. The problem with that model is that the world is not standing still. And by the time you have implemented the thing that you worked so hard to get the money to do, the options you have available to you to solve the problem you were intending to solve are many more and much different. And so what we have to create in our healthcare organizations is a way to enable continuous innovation. We need to have funding and governance models that empower innovation. Let me give you an example. I'm going to tell you a story from a different industry, but we'll see if this makes sense. When I was a kid, if you wanted to watch a movie on a Friday night with your family, there was no internet. So you get in the car and you drive to the store. The store was called Blockbuster, and they were on the street corners, and it's okay. And you walk through the aisles and you find the movie you want to watch, and you get some candy, and then you go home and you watch the movie, and pretty soon you got to bring the movie back, and you're probably late and you have to pay a fine, and then you want to go see another one, you go, okay. Well, around the late 90s, along comes another company called Netflix, and they say, guess what? You don't have to go to the store anymore because we're going to mail you these DVDs, right? You just tell us what you want, we'll send them to you. Revolutionary. Well, if you fast forward to today, I don't get DVDs in the mail anymore. Now I just pull out my phone like everybody else and I stream content from my phone. Same company, Netflix. Why do I tell you this? Well, number one, Blockbuster had a vision and a strategy, had a platform architecture, probably had some data, probably had some governing models, but they did not have them aligned to a spirit of continuous innovation, and they are dead and gone. Netflix, on the other hand, came along with shipping DVDs, and lo and behold, less than 10 years later, they're streaming content to us around the globe on mobile devices. And I can guarantee you when they started shipping those DVDs, they had no idea that one day they would be streaming content to us around the globe because the iPhone didn't even exist. The technology was not there. And if they had just invested in being the best DVD mailers on the planet and digitally transformed the way that they ship these DVDs, they would be dead too. But they're not. And they're not because they enabled a spirit of continuous innovation. Netflix's vision and strategy that is shared is we will entertain the world. Not we will be the best DVD mailers on the planet. We will entertain the world. And the way we'll do that is whatever the best way is to do that as the technology around us changes. Is your health system Blockbuster or Netflix? Is an important question to ask yourself. It leads to number 5, which I realize is very hard to see on this slide, so I'll tell you. This says priority development. This is about how do we decide what the most important thing to do is next. So often in healthcare, the answer to that question is the loudest voice in the room. The person with the biggest title has an idea that we should follow, and we do it because they said so. This is not going to get us where we need to go. As an organization, I offer you that you should ask yourself, how do we make decisions about what is most important? And is it aligned with our shared vision and strategy? The question should not be, what do you think or what do you want? The question should be, what is the best way to use our available resources to achieve the purpose that we serve? Priority development. Number 6, I'm mindful that all of this is pretty new to healthcare. While a lot of this is not new, it's new to healthcare. And because of that, as an organization looking for the path forward in digital transformation, a key part of our competency is talent. Where do we have the talent that we need to work in this way that we're talking about? And if we don't, where do we get it? Can we hire it? Can we contract it? Do we need to explore partnerships? I really think that the answers to what healthcare needs today are not really found inside healthcare today. Some of it is, but some of it is not. And when you are truly embarking to create the competencies for digital transformation, considering your talent strategy, how you source it, how you level it up, how you coach it, is an important part of that, preparing that soil that we talked about. And number 7, to round out this slide, culture and change leadership. We talked about it yesterday. It comes up every time you talk about this. It in itself is not enough, but without it, none of the rest of it matters, right? If we don't have a culture that allows us to innovate continuously, that allows us to be excited about change, and not change for change's sake, but change for innovation's sake, change for purpose sake. If we don't have that culture because somehow we have a death grip on our financial metrics, or a death grip on my job role, or a death grip on our traditional ways of working, then we cannot do this. Let me offer you one more analogy that I often use when I share this story, and it's the analogy of origami. If you'll imagine for a moment that healthcare is a piece of origami, a piece of paper that's been folded into a shape, let's call it a boat. So we're sailing along as this healthcare boat in this analogy. And along comes the digital revolution, and we say, we've got to transform, we've got to change. And the people on the boat say, no problem. I can move these chairs over here. I can paint this room a different color. I can move this person's job. I can remodel. I can sail my ship in another direction. Okay, fine. You've changed some things, but you really haven't transformed, because what you failed to consider is the potential that lies in the paper. It's not about destroying the paper. It's about letting go of being the boat so that you can come together in a new way to be the butterfly. This requires cultural shifting and change leadership in healthcare, and it requires some sense of what that butterfly in the analogy looks like, and I hope that these examples will give you some insights as to what I think that might be. I have one more thought to share with you in closing, and it returns to the power of purpose. When I first went from being a therapist to doing electronic medical record implementations, I found myself in a room of really smart doctors and really smart EHR programmers, and the conversation went something like this. The EHR programmer asked the physicians, "What do you want?" And the physician said, "I want it to look like this piece of paper that I've been documenting on for 20 years. And they looked at it and said, "Okay, we could do that." And they built it. And this happened over and over and over. And we created a system that was not transformative. It was just digitized. And it failed to take into consideration the potential that lied in the resources that we had. So at this intersection, I drew this diagram then. It was 20 years ago. I drew this diagram then, and it's this idea that at the intersection of what we want and what is possible, there is a zone that I call the danger zone. And it's a danger zone because of the scenario I just described. If you just ask what you want and then you build it, if it's possible, you may or may not achieve the things that you want to achieve because you haven't yet asked the question. So here's the thing that matters most. Shared vision and purpose. To what extent do we understand the problems we are trying to solve? Because when we have that top bubble, we have more clarity. There is still a danger zone. I warn you about this because people will have strong opinions of things they want that are possible, that are down here. And as an organization, it's important to be aware of that. There are other areas too, like things you want to do and they're aligned with your purpose, but they're just not possible yet, so we aspire to them. There are things we will defer because for whatever reason, they're not the most important one. But at the middle of this diagram is a place where we all want to be. This is where our strategy lies. And I'll leave you with this thought for your consideration. It is everybody's job to make sure that our organizations are at the center of this diagram on our digital transformation journey. And what you think and what the people in your organization think is not nearly as important as how you think. Taking those 7 organizational conditions, nurturing them, preparing the soil for your efforts in a digital world, I hope will help you achieve value from your investments. Muito obrigado for your time and attention this morning.